Let's bring in Dr. Joe. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Appreciate him getting us on his calendar over 25 years, part of this morning show. Joe, what's on your mind this morning?
Hey, Ray, I've been waiting a long time for this one. We have had some pretty mild winters, especially with snow, and there's a lot of people that like to be outside and snow sports. And there have been people, obviously, in the last several years that have gone to ski resorts around the country or even regional ski resorts. But around here, we hadn't had a really good ski and snowboard season until this year. We're really down at Children's, at our place at the Sports and Orthopedic Center, seeing a lot of ski and snowboard injuries. So I wanted to review a few with you today, briefly, if I can. So I came up with the use and the help of my fellows, we looked up a bunch of articles on the 5 most common ski and snowboard injuries that you'd see, and see if this really fits with that 30-plus years, 35 years that I've been in practice. Is this a pretty good fit, as we see? And so number one is wrist fractures and injuries to the thumb, skier's thumb. Particularly wrist fractures. They make up about 33 to 35% of injuries. People falling on the wrist, breaking the wrist, kids. Skier's thumb is when you fall on the hand and you bend the thumb back and you sprain it pretty bad or sometimes even break it. That's 33% of injuries in ski and snowboard. Number two, and this is the one I have seen the most because the kind of clinic I'm in, I would see a lot of shoulder dislocations where people fall, they pop the shoulder out, they sublux it where it pops out part way, they struggle with shoulder pain for the remainder of the snow season and frustration and rehab, but it usually heals over time. And shoulder dislocation was about 15 to 19%. Number 3, definitely knee ligament injuries became a big thing. I remember when, again, being in this field for a long time, it used to be in the late 80s and 90s that it was fractures of the tibia, lower leg fractures. Oh, you're going to go out and ski and break your leg. And then they did a really good job changing the boots and the bindings and stuff. But what it did is it sort of put a little bit more stress on the knee. And there's a lot more of rotational injuries in snowboarding and in skiing, too. And so we definitely see, and we have already this year, ACLs and MCLs, and even people who tear cartilage with ACLs and MCLs related to their skiing and snowboarding, about 15 to 17%. So number 3 on my list. Number 4, I like unique injuries that have kind of cool names. And there's a thing called snowboarder's ankle. I've been waiting a few years to get a chance to say that again for a while. Snowboarder's ankle, Ray, is what happens is people call them ankle sprains, but you really don't sprain your ankle the way you do in basketball or football or something, or soccer, where you twist it because you're in a boot and a binding. It's what happens is people fall awkwardly, and when they fall awkwardly, they put a lot of stress on the outside part of the ankle. And there's a small bone out there called the talus that gets fractured. It's kind of hard to pick up, but a tip-off to me for the years is kids will have a boot on, and they say it's an ankle sprain, and you see them a month later, still an ankle sprain, it's just not getting better. And there's a unique X-ray that we have to get to pick up this injury called snowboarder's ankle, by the way they fall, and an injury, awkward landing to the talus. And so that's about 14 to 16% are ankle injuries. And then, of course, number 5 is head injuries. And there's good news and there's not so good news on head injuries as I've looked this up, as hadn't followed it in a while. We did a study way back around 2000, our fellows back that year, and looked at, this was pretty bad numbers. We looked at ski slopes in Ohio and ski slopes in Massachusetts, and only about 15 to 20% of kids who went skiing, at that time more than snowboarding, but snowboarding picked up, of course, only about 15 to 20% wore a helmet. And nowadays, the studies are showing, and I went around the office to people who have taken their kids to places in our regional here, it's a much higher percentage. About 70 to 75% of kids are wearing helmets now. And that's really good news. I'm excited about it. I'm happy that, hey, the word's getting out there and understanding that the head is an important thing to protect. But I do want, on the other flip side of it, I want people to know that wearing a helmet does not do a great job protecting against concussions. Remember the whiplash and snapback that we see in other sports too. What it does a great job of is it protects against skull fractures and bleeds. And unfortunately, back in the late 90s, we used to have a lot of people go into the emergency room with skull fractures. I'm thrilled to hear that we're up over 70% of kids now wearing helmets. But remember, you have to be careful with concussions. So skiing injuries are about 2.5 per thousand, snowboarding about 3.9. So there's more snowboard injuries than ski injuries. But that's the big five. And very quickly, if I have one more minute, I want to say that there's 5 things also that you can do to protect against those things. Number one, we just said that wrists get injured a lot. Wear wrist guards. They're really helpful in protecting against these wrist fractures. Number 2, get lessons and learn the lessons. They'll teach you how to fall correctly. You're going to fall if you ski and snowboard. Learn how to fall correctly. Number 4, get a well-fitted helmet. And number 5, stop when you're tired. People get out there. They don't get a chance to get out there much. Many injuries occur when people are already tired. So those are 5 things we can do to protect against the 5 big injuries. And finally, this year with a snow year, I got a chance to get my 5 ski and snowboard injuries in. And thankful to you for listening to me today, Ray.
Well, Joe, you must have been talking to my wife when you mentioned the word fall. Last time her and I went skiing, I said, boy, you had a fun time skiing today. And she looked at me and she said, you had a good time falling today, didn't you? And that was the last. Yeah, that was the last time I went, and I kind of looked at myself in the mirror and said, you know what? I think my skiing days are behind me for sure. But I agree with you, Joe. It's great fun to ski and snowboard. I know my kids all have enjoyed it through the years, but I love this piece because really good information, how to fall correctly, what to take care of, do some precautionary thing, because Joe is exactly right. You're going to fall. It's just what you do when you ski, but how to do it properly and get that preventative stuff in place can really help you. Excellent piece, my friend. Thank you so much for joining me.
Thanks, Ray. Enjoy the rest of the week. It's looking pretty good.
I got it.